People often ask me how long does it take to place an implant. Well, it usually takes about an hour to place one implant, and if you're placing 4 implants in an arch, it usually takes 2.5 hours. The patient comes back in 12 days to have their sutures removed, and then we'll see the patients 2.5 months after that to take x-rays to make sure that those implants are integrated with the bone. Here in our office, we offer 2 types of sedation. We offer nitrous oxide, and we offer oral sedation. And that's usually enough to get them relaxed to go ahead and do the procedure. Very little pain associated with implants. First of all, you're completely anesthetized, so all the areas that we'll be working on are blocked, the nerves are blocked. There may be some pain afterwards. Most of our patients usually take Motrin or at most 1 or 2 pain pills. If you're orally sedated, you need to have a driver, and the driver has to be present during the procedure. If you're not, you can drive. If you're driving a long distance and you have 4 implants to place, we suggest you have a driver, but it's not necessary. A question that's often asked, will you leave the office without teeth? Well, if it's 1 or 2 implants, usually there's a temporary partial that's made for you, and that replaces those teeth. Anything in the aesthetic area, when you leave this office, you will have teeth. In the upper arch, if we place 4 implants in the upper arch, the patient will leave the office with an upper denture. In the lower arch, many times we'll let it heal for 2 months, and they'll have a lower denture, but basically it will be not for chewing or for mastication. That'll be more for aesthetics. Regardless of how many implants you're going to be receiving, you'll be leaving the office with dentition, partial dentition, either a denture or a partial or an implant that's immediately stabilized. People often ask, how long does it take for the bone to integrate to the implant so that they can get their permanent dentition? Well, it's anywhere from 2.5 to 4 months, depending on the healing and depending on whether those implants were placed into extraction sites. As far as cost of the implants, the cost varies. One of the variables is the type of implant that's being used. Another thing that varies is whether you have enough bone to place that implant. If you don't have enough bone, then you have to have a bone graft, either to expand the ridge or to gain height in the ridge. And that's another costly factor. In our office, when a patient comes in for his initial exam, we do a complete exam. We have the latest technology. We have cone beam technology, which is a CAT scan of the head, and it gives us a lot of information as to the height of the bone, the width of the bone, and whether this patient can have an implant in that area easily, whether the sinuses are involved or whether the mandibular nerve is involved, and the patient is given a complete evaluation. And it was very important that we give the patient their options. And once the patient has their options, it's up to the patient to decide what direction they want to go. In the last 15 years, there's been a lot of innovations in implantology, from the type of implants, the design of the implants, the design of the abutments to make it very easy, and the surfaces on the implants, the cone beam technology, which shows you how much bone you have. All the innovations that have taken place in the last 15 years, we've incorporated into this practice. It's very important to select an implantologist, that is experienced in all these different facets of implants. Here at our office, we do everything possible to make sure that these implants are placed properly so that you have a strong long-term result. The only thing that we ask is that you come once a year for us to take a look at these implants, to x-ray them and make sure they're well taken care of, and they should last for many, many years.